The radial arterial puncture is used to elucidate aberrancies in pH that are caused by ventilation, perfusion, and metabolic abnormalities. Art sticks are rad! An art stick is used to draw an ABG. ABGs are useful in telling us why a sick patient is so sick. It can tell us if the root of the illness is due to the body working in overdrive, an issue with blood supply or gas exchange to the lungs, and can help guide the care that stabilizes the patient. Radical. Before an art stick, explain why it's so important to the patient and their family. Then collect your equipment. You will need a blood gas syringe, ChloraPrep, biohazard bag, gauze, Coban, and gloves. Also, eye protection is recommended. Drawing an ABG is an advanced skill. Cutting off blood supply can cause nerve damage or even loss of the hand. For this reason, before an art stick, we perform an Allen's test. This will tell us whether or not there's adequate supply from the ulnar side of the wrist in the event that we mistakenly blow the radial artery. Here's how you do it. First, perform hand hygiene. Raise the patient's arm over their head. Pinch each side of the wrist with your thumbs. One thumb occludes the ulnar artery, one thumb occludes the radial artery. Have the patient pump their fist a few times. If they're unresponsive, passively clench it for them. Since you've been cutting off blood flow, the hand will turn pale. Now let go of the ulnar side. This simulates that you just blew the radial artery and there's no blood flow from that side. If there's adequate circulation from the ulnar side, the patient's hand returns to its normal color within 5 to 15 seconds. Color return in 15 seconds or more is a negative test. If one wrist fails the Allen's test, try the other. If that fails too, then consult the provider or RT for a possible brachial or fem stick. After a successful Allen's test, you're ready to poke the patient. A rolled towel can help by bringing the artery closer to the skin surface. Perform hand hygiene and don clean gloves and prep the skin with ChloraPrep. Scrub vigorously back and forth. Allow it to dry. Don clean gloves. Palpate for the artery with your non-dominant hand. Avoid overlying veins. Find the point of maximal impulse. Grab your blood gas syringe. Ensure the bevel is up. Making the safety cap 90 degrees from the bevel can help you keep the bevel up once you've punctured the skin and can no longer see it. Puncture the skin at a steep angle, 30 to 60 degrees. Arteries are deep. A steep angle will help you quickly get down to the artery. Arteries are pulsatile. A successful stick will result in blood pulsating into the syringe. If you aren't immediately successful, change your angle and reapproach without fully withdrawing the needle. Never use the same needle for a second poke. If you see someone do this, tell them not to act a fool. Hand them a new syringe. After you've got 1 to 2 mils of blood, withdraw the syringe and apply direct pressure. Cap the needle. Maintain direct pressure for 5 minutes or until hemostasis is achieved. Express the air out of the syringe. Roll the syringe gently for 30 seconds. This mixes the heparin with the sample. Label the specimen, print the rec, include the patient's temp and FiO2. Discard your used supplies in the appropriate places. Walk, do not tube the sample down to the lab. Document the draw, the site, and how the patient tolerated it. Are you ready to be radical? Great, let's grab some fake arms and practice for real.